discuss regarding the vaccination in chronic kidney disease and kidney transplant recipients. So, learning objectives will be to understand the immune response in chronic kidney disease patients and also in case of renal transplant recipients, and to learn about the recommendations of vaccination in CKD and kidney transplant recipients. So all of we have noticed that during COVID pandemic, the vaccination has played a major role in preventing lot of morbidity and mortality. So also in CKD patients, they are very prone for infections. CKD patients on dialysis and also kidney transplant recipients, they are prone for major infections. So immunization remains an important component of preventive care. So immunization has lot of safety profile, and because these patients are high risk for infections, immunization is very important in these patients. But problem is that immune response is in this population is impaired as compared to the normal population. So chronic kidney disease is defined as abnormalities of the kidney which are either structural or functional abnormalities which last for more than 3 months with implications to the health. So when patient goes into CKD stage 3-4, he has limited options. Either he has to go for dialysis, either hemodialysis, peritoneal dialysis or transplantation. So these patients are, as a result, are very prone for infections because of older age, associated comorbidities like diabetes, hypertension, ischemic heart disease, etc. CKD is a state of immunosuppression. CKD is itself a state of immunosuppression. So, and also these patients need to come for dialysis in the hospital. So they are prone for hospital-acquired infections. So CKD has profound effect on both innate as well as adaptive immune system. And this is specially exaggerated in dialysis patients and kidney transplant recipients, because of which they are prone for increased number of infections. So by virtue of their immunosuppressive state, CKD patients are at increased risk of infections. Some of these infections we can prevent by giving vaccination to them. So knowledge about vaccination is imperative to treat CKD patients effectively. So why there is low response to vaccination in case of CKD patients? Because there is low number of B lymphocytes, CD4 plus T lymphocytes. Also, the response, T cell response to the antigenic stimuli is also reduced. Also, there is impaired monocyte functioning, and also antigen presentation is also impaired. And also there is impaired functioning of the neutrophils. All because of these problems, the response to the vaccination is very low. So studies have suggested that when these CKD patients, when we immunize them with vaccines in the early stage, that is before they go for dialysis or transplantation, the seroconversion or antibody production is much better. So in case of chronic kidney disease patients, we can give both killed vaccines or inactivated vaccines as well as live vaccines. So generally we concentrate about the hepatitis B, pneumococcal and influenza vaccines. Other vaccines in some patients we can also recommend depending on their age and their risk of infection, like varicella, hepatitis A, mumps, measles, rubella, inactivated poliovirus, diphtheria and tetanus toxoid. So we'll now discuss regarding individual vaccinations. So hepatitis B vaccine. Hepatitis B vaccination is very important because CKD patients are prone for hepatitis B infection, because these dialysis patients, there is handling of blood. So because of that, there is very high risk of hepatitis B infection in these patients. So hepatitis B vaccination is recommended to all CKD patients. Hepatitis B vaccine is a recombinant vaccine, and there is also plasma derived vaccine, but plasma derived vaccine is not preferred due to fear of plasma mediated disease communication. So CKD patients who were vaccinated before they required dialysis, they had higher seroprotection and higher antibody titers. So Hepatitis B vaccine, generally in normal patients we give 3 doses, 0, 1 and 6. But in case of CKD patients we give 4 doses, 0, 1, 2 and 6. And the dose is doubled in case of CKD patients. Normally we give 20 microgram, but in CKD patients it is 40 microgram. So double dose and 4 doses, they give better seroprotection, and vaccine is given like similarly in normal subjects, like intramuscularly in deltoid region. And anti-HBs titer is measured after the primary course is completed, 1 to 2 months after the primary course is completed, and annually thereafter. So booster doses are generally given once the anti-HBs titers they fall below 10 million units per ml, and revaccination with full dose is recommended when there is anti-HBs is less than 10. And antibody titers, they tend to fall with time in patients on dialysis, therefore they need annual monitoring of the anti-HBs titer. So in some patients, even after two courses of vaccination, they don't develop sufficient antibody titer. So in such cases, we give some adjuvant to them. These adjuvants are zinc, erythropoietin and certain immunomodulators. So next vaccine is influenza vaccine. It is available in India as a killed vaccine. Other vaccines like nasal spray vaccine, which is a live attenuated virus, is also available. As the influenza virus, it constantly mutates, a new batch is prepared every year. The vaccine becomes effective against influenza virus after 2 weeks of the administration. And since peak influenza season begins in the October, November to the May, so the best time to take influenza vaccine is either October or November, before the season starts. So it is given 0.5 ml single intramuscularly in the deltoid muscle, and household contacts and all healthcare workers should also be vaccinated annually to decrease the transmission to the high-risk CKD patients. Next vaccine is a pneumococcal vaccine. The burden of pneumococcal infection in CKD and kidney transplant recipients is very high. So these patients, the cost of pneumococcal vaccine is low as compared to the treatment of pneumococcal infection. And there are no significant disadvantages of pneumococcal vaccination. So pneumococcal vaccination should be administered to all the CKD and kidney transplant recipients. Recommendation is we give 13 valent conjugate vaccine followed 8 weeks by the 23 valent polysaccharide vaccine. So pneumococcal vaccine has two forms. 13 valent conjugated vaccine, it consists of capsular polysaccharides which are covalently bound to the diphtheria toxoid, which is highly immunogenic but non-toxic. And this combination results in mucosal immunity and lifelong immunity. While polysaccharide vaccine is prepared from the polysaccharides from 23 subtypes, and this vaccine is less immunogenic, but it generates herd immunity, and also it protects from the respiratory tract infections, and there is no mucosal immunity with the polysaccharide vaccine. So live attenuated vaccines only are given in the CKD patients, but not in the transplant recipients. If the transplant recipient need to, if the CKD patient has received a live attenuated vaccine, then he has to wait for the transplantation for at least 4 to 6 weeks. So children between 1 to 12 years should receive single dose of 0.5 ml subcutaneously varicella vaccine, which who do not has developed a chicken pox in the previously. Adolescents and adults who has not developed chickenpox in their childhood, they may also take these vaccines. They require 2 doses of 0.5 ml subcutaneous vaccines, which is 4 weeks apart. And MMR vaccine is given to children, those who are on the dialysis between 12 to 15 months of age, with a booster at 4 to 6 years of age. So this is about the vaccination in chronic kidney disease patient. Now we will discuss about the vaccination in kidney transplant recipients. So this is a timeline This is a timeline of infection in kidney transplant recipients. After kidney transplant, less than 1 month, these patients are prone for nosocomial and all these technical donor or recipient derived infections. After 1 to 6 months is a period of maximum immunosuppression. So these patients are prone for activation of latent infections, relapse, residual, opportunistic infections. And after 6 months, these patients are prone as similarly as the community acquired infections. So vaccine preventable diseases are important cause of morbidity after kidney transplantation. Vaccine immunogenicity is generally reduced in both CKD as well as post-transplant setting. However, data suggests that some vaccines are more immunogenic when given pre-transplant rather than post-transplant. So live attenuated vaccine should only be given prior to the transplant, and therefore assessment of vaccination status is an integral part of pre-transplant evaluation. Inactivated vaccines we can give either before or after the kidney transplant, but live vaccines we generally avoid in kidney transplant recipients. So KDIGO has given certain guidelines regarding vaccination in case of CKD and transplant patients. So vaccination series we commence using an accelerated schedule if necessary prior to the kidney transplantation. And we should not exclude any candidate who has not completed the inactivated vaccine series prior to kidney transplant. Vaccination series be completed prior to kidney transplant for any live attenuated vaccines. And if live attenuated vaccines has been received by CKD patient, then we have to wait at least for 4 to 6 weeks before he proceed for the kidney transplant. So in certain situations like splenectomized candidates or those at increased risk of post-transplant splenectomy, they should receive pre-transplant pneumococcal, hemophilus and meningococcal vaccination. So we recommend that candidates requiring complement inhibitors either preoperatively or postoperatively, they should receive meningococcal vaccination prior to the transplant. We suggest administering following vaccines to certain candidates which have increased risk, like in certain population, rabies, tick-borne meningoencephalitis, Japanese encephalitis, meningococcal vaccine, Salmonella typhi, and yellow fever. These are administered in specific populations depending on the risk of exposure. So timing of vaccination after kidney transplant. Generally, first 6 months are the phase of intense immunosuppression. So the vaccine response, that is immune response, will be suboptimal during this period. So best time to vaccinate these patients is after 6 months of the kidney transplant. And generally, we prefer inactivated or killed vaccines, and live attenuated vaccines are different. So type of vaccine, again live attenuated vaccines, they pose considerable risk of unchecked vaccine strain proliferation and vaccine induced disease in the transplant recipients. So live vaccine should be administered as early in the course of CKD before transplantation. And after administration of a live vaccine, we have to wait for minimum of 4 to 6 weeks before the patient goes for the immunosuppression and transplant. So all these patients, as the seroconversion rate is very slow or reduced, so we have to monitor, we have to document there is sufficient antibody titers at least 4 weeks after completing the course of vaccination. So vaccination in healthcare workers and household contacts. So in general, inactivated vaccines are prepared in these patients, and administration of live vaccine to these household contacts can result in viral shedding, which can potentially result in vaccine-induced infectious disease in the transplant recipient. So again, hepatitis B vaccination, we generally give hepatitis B vaccination in the course of CKD only, but we have to monitor the antibody titer after the kidney transplant. So annually anti-H-based titer is measured. If it is more than 10, that means patient has a sufficient protective antibody response. If the titer is less than 10, then we have to again revaccinate these patients for the hepatitis B vaccination. So So pneumococcal vaccine generally before transplant we should give, but if the patient has not received pneumococcal vaccine before transplant, we can also give it after transplant. So after 6 months we can give 13 valent PCV vaccine, and after 8 weeks of waiting period we can also give PPSV 23 valent polysaccharide vaccine. So and booster dose every 5 years with the PPSV 23 vaccine. Influenza vaccination. Amongst the various flu vaccines, injectable inactivated vaccine is safe in kidney transplant recipients, whereas nasal live attenuated vaccine is contraindicated. If the ESRD patient receives a live attenuated influenza vaccine, he should not be immunosuppressed preferably for the next 4 to 6 weeks. And after kidney transplantation, routine annual inactivated influenza vaccine should be administered to all the transplant patients. Varicella vaccine is indicated for CKD patients who are varicella zoster virus IgG negative. So as this is a live vaccine, this vaccine is contraindicated in kidney transplant recipients. It should be administered at least 4 to 6 weeks before the patient goes for the kidney transplantation. And if transplant is emergently indicated, like if he gets cadaveric kidney or something, then this patient should receive peri-transplant prophylaxis with either IV acyclovir or oral valacyclovir. Herpes zoster virus, herpes zoster vaccine is effective for prevention of shingles in elderly patients who are more than 50 years of age and who are varicella zoster virus IgG positive. So this herpes zoster vaccine is beneficial in CKD and can reduce risk of zoster by approximately 2-fold. However, this is a live attenuated vaccine, so minimum period of 4 weeks should elapse before the patient goes for immunosuppression and transplant. And in general, the inactivated herpes zoster vaccine is preferred over the live zoster vaccine. Meningococcal vaccine is recommended in certain children's depending on the local guidelines, and also in case of adults, if he goes for any functional or anatomic asplenia, those who undergo desensitization protocol, EBO-incompatible transplants, and traveling to the endemic areas, or those likely to require complement inhibitors. So in these populations, they require pre-transplant vaccination with the meningococcal vaccine. So it comes in quadrivalent vaccine. So 2 doses are necessary. First dose is followed by 8 weeks by the second dose. Hepatitis A vaccine is inactivated subunit vaccine that can be administered in high-risk individuals or a potential to contract the viral infection from food, water, or body fluids of infected individuals. So this hepatitis A vaccine, one study has shown that reasonable seroprotective rates with the 2-dose regimen among solid organ transplant recipients. So in endemic areas, hepatitis A virus vaccine should be given to all candidates before transplantation. Then polio vaccine, oral polio vaccine is contraindicated in transplant recipients because it is a live vaccine. But injectable inactivated polio vaccine, which is given intramuscularly, this is safe and effective. And also pediatric transplant recipients should not take part in the pulse polio campaign because this is a live attenuated live vaccine, so they should not take it. And injectable inactivated polio vaccine is safe and effective in pediatric transplant recipients and should be vaccinated according to the regular schedule of immunization for polio. Then typhoid vaccine, live oral typhoid vaccine is contraindicated, but there is also availability of killed VI polysaccharide vaccine which can be administered in the post-transplant patients depending on the requirement. Then HPV vaccine is generally indicated between 9 to 45 years and 3 doses are generally needed, which is given intramuscularly. Yellow fever vaccine, this is also a live attenuated vaccine and it is contraindicated in case of kidney transplant. But CKD patients can take it before transplant, and after taking yellow fever vaccine, they should wait at least for the 4 weeks before they proceed for the transplant. So all the live vaccines are contraindicated after transplants. All the inactivated or killed vaccines we can give either before transplant and also after transplant. So kidney transplant recipients, generally we administer them pneumococcal vaccine, influenza vaccine and hepatitis B vaccine. And live related vaccines, if required, we give before transplant, and we'll wait for 4 to 6 weeks for the clearing of the viremia. So in summary, patients with CKD and renal transplant recipients, they carry increased risk of infections, potentially catastrophic complications of such infections, as well as reduced immunogenicity following vaccination. So in general, all immunization related details should be obtained prior to transplant. Any planned vaccine should be administered early in the pre-transplant phase, at least 4 weeks before kidney transplant. Inactivated vaccines are considered safe beyond the first 6 months after transplant, and live vaccines are contraindicated throughout the post-transplant period. The reduced seroconversion rates and faster antibody clearance in transplant patients mandates regular screening for antibody titers and administration of booster doses when necessary. Thank you.
Sir, just one question.
Yes, sir.
What is the percentage of pneumococcal meningitis?
Percentage of
Pneumococcal meningitis. Pneumococcal meningitis.
pneumococcal meningitis means
Yes, percentage.
incidence or prevalence?
No, incidence.
Incidence. So pneumococcal meningitis generally the prevalence is almost more common in elderly patients who are more immunosuppressed. So the prevalence is generally 5 to 10%. So
Why I'm asking this question? Because when we used to get cases in PMT, cases of pneumococcal meningitis, nobody survived. Because of maybe that because the organism has got a capsule, it was difficult to this antibiotic
Yes, sir.
penetrate inside. But nobody survived.
yes, sir.
I
Mortality rate
cases
is
in my
much
life.
very high. Mortality rate is very high in case of meningococcal meningitis.
So vaccine does it work properly?
Definitely, vaccine has certain preventive has a role in prevention. So those patients who are at increased risk, they should take vaccination.
But
So
people they are not aware of this. Many times they vaccine होने के बाद बोलते हैं कि ऐसे आपको पता है.
generally, meningococcal vaccine, pediatricians they give to all these childrens in areas where there is lot of endemicity. But in adults, I don't think anybody gives. But in CKD patients, we generally give because they are going to go for transplantation, they are going for high immunosuppression. So we generally give before transplantation. And we'll wait for 4 to 6 weeks for the clearance of the viremia. Thank you. Any other questions?